Hi, this is Dr. Bob Danohoff, the Public Health Officer from Douglas County. It is February the 5th, and this will be our update. This today is a special one, talking especially about vaccines, but as always, we can't help but talk a little bit about other things. So in the world, still an active pandemic with 105 million cases, 2.3 million deaths. Although the number of cases in the world really is starting to decline, and the number of deaths is beginning to decline. In the U.S., we're at 27 million cases and 470,000 deaths. And I think in the U.S. overall, cases are down, deaths are starting to come down, and hospitalizations are down. Oregon, still not one of the least affected states, 145 cases and 145,000 cases and 2,000 deaths. And Douglas County also doing well. So as I promised, we're going to get first the vaccines. So we think vaccines are our way out of this pandemic. The public health measures that we're using of masking and social distancing and whatever certainly can help, but we do not think they are enough to get us out of the pandemic by themselves. And so we're also going to need vaccine. And the good news is we have two excellent vaccines out there. We have the Moderna and the Pfizer vaccine, both of which are over 90% effective. These are mRNA vaccines, which seem to work very well. I had my second yesterday, and I was a little tired today, and a sore arm, but other than that, not a big deal. So we've got a vaccine, we've got a good vaccine. So the staging of the vaccine, the sequencing of the vaccine started with the CDC that made recommendations for the 1A, 1B groups. So again, the 1A group are people in nursing homes, people in memory care, first responders, and healthcare workers. We're pretty much through with that. The second group in Oregon, the 1B group, were teachers and child care workers in early learning. We started on them on the 25th. We're pretty much done with those. And now we're ready to start on vaccinating our seniors. When you look at it, seniors have really had a terrible time with this. When we look at the number of deaths, we have no deaths in people under 50. All of our deaths in people 60 and above. When we look at our hospitalizations, we have an occasional hospitalization of somebody less than 60, but again, most of our hospitalizations are in people 60 and above. So they seem to be really at risk for the disease, at least tenfold higher than the lowest risk group, and that's why we are ready to go ahead and vaccinate seniors. I was spent yesterday listening to all of the other county plans. They don't have much of a plan. Many are talking about doing big events, and I think big events for seniors just don't make sense. You know, we've done a bunch of big events for educators and healthcare workers, and they worked out okay. There were lines, people waited outside, people gathered a little bit. Probably that's okay for younger people, but we really don't think that's a good way to do it for seniors. So Douglas County has come up with an approach. Actually, it was reported today. It was reported today on OPB that they said, that's going to be the model for smaller communities where we are going to have vaccines go to those places where people get care. So the method on how seniors are going to get vaccinated, you should get vaccinated where you get your regular care, or would you get your flu vaccine. So we've been able to distribute vaccine to most of the primary care practices in town. We've distributed it to the oncology practice. We've distributed it to a dental office. We're distributing it to several of the pharmacies in the area. So you should be able to do it. The big problem with this is there's not enough vaccine. So we know, looking at the population data, that there's 7,200 people 80 and above in Douglas County. 7,200, that's a lot. And the amount of vaccine we got for them, 700 doses. 700 doses to cover 7,000 people. I'm trying to figure out how to do fishes and loaves, but we don't know how to do that. So what's going to happen is there will be, of those 7,000 people, many thousand who want the vaccine and only 700 doses. But we're asking people to sign up with their doctors or sign up with the pharmacy, and they're going to make schedules out there, and then they'll go ahead and get you in to get the vaccine. So if you go to the questions, where's the list of people doing vaccines for those eligible, and should I call them today? Please don't call them today. People are not eligible for the vaccine until the 8th. We're not going to get the vaccine until the afternoon of the 8th or the 9th, so please don't call them today. These people don't want to have their phones totally overloaded through the week. Now, some of the practices have already reached out to their patients 80 and above and already scheduled them. That's a great thing. But please, on Monday, call either your doctor or the pharmacy. Now, we have a list in there of people who got vaccines, and so you can get a vaccine at any one of those places. So Vicky says, how do I get the second vaccine if I was vaccinated on the 23rd? So the 23rd was a mass event at the fairgrounds. You typically get the second dose where you got the first dose. It was a little complicated because they gave some Pfizer vaccine where you're supposed to get the second dose in 21 days, and then the Moderna vaccine where you're supposed to get it in 28 days. The other thing is the state is behind on second doses. So for example, they're supposed to send it on the 25th day. This time they've been sending it on the 32nd day. So if they're not sending the second dose until the 32nd day, it's pretty hard to give it on the 28th day. The good news is there's 21 and 28 days. There's the minimum time. It's not the maximum time. These can be given days or weeks, even months later, and they still work. So I don't think we have to fret with that. So Aviva, who did the event on the 23rd, has the name of all the people, and when they finally know when they're going to have vaccine, they will do it. So Dr. Fauci said this week it's important to follow the timing of the second dose. Actually, it was much more nuanced than that. He still wanted to go with the second dose. There's been a big movement among several very smart people in the country to say that we should give more first doses to more people and hold on the second dose as they do in the UK. We're still not getting there yet. The state is holding back second doses so that we'll have it. As I said, they were a little late this week, but otherwise they're coming. Balto says, is Douglas County still receiving a lower per capita share? No, we are receiving the appropriate per capita share for the elderly population, but we're so far behind on the 1A population that it's going to take us a while to get back there. However, I was promised by the person doing this that we will eventually catch up. So how will the pharmacies handle the influx of calls from the public? They handle a lot of calls, right? They handle a lot of calls for refills and other kind of things. And the pharmacies are probably better arranged at getting vaccines to people than almost anybody else. And so we think they're going to do it. Now, they do not get very much vaccine. So the pharmacies only got 20 or 40 doses, not very much. They could do 20 or 40 a day, but because of the small amount of vaccine we got, they could only get a small amount. So Debbie says, what about the second shot for the disabled and their workers? Again, you should get the second dose where you got the first from the same people as the first, because the people who gave you the first will get a dose of the second for you. And so if you got it at a doctor's office, you should get it at a doctor's office. If you got it at the fairgrounds, from Aviva, you should get it at the fairgrounds from Aviva. It's a little complicated because early on there were these mass events in places like Salem, and so some people drove up to Salem to get their vaccine. Their second dose is going to come to Salem, so you really need to drive up to Salem to get your second dose. Well, Judy says, I don't go to any of the listed primary care providers. Yeah, well, that's going to make it harder, although the pharmacies will have some doses. So how can we make appointments? Our age group is eligible on the 22nd, Marianne says. So if your age group is eligible on the 22nd, we would ask you wait until the 22nd. Our providers have all agreed to go ahead in the descending age fashion. You might talk with them and they say, fine, we'll take your name so you don't have to call on the 22nd. But again, we really are following that. Now the problem is going to be with only 700 doses for 7,000 people, we think that come to the next week, February 15th, when it's time to do 75 plus, there's still a lot of 85 plus who haven't been vaccinated. And so the scheduling is going to get further and further behind. It really is gross. So Jerry says, White Oak is my doctor, and I think they're working on, I talked to them this week, I think they're working on getting their becoming a COVID-19 provider. So that would be great. If they're not signed up in time, you can go to one of the pharmacies. So Desi says, if you have been positive for COVID in the past few months, should you get the vaccine anyway? So there's a complicated question. Two things. One is we think that people who've had the disease have pretty good immunity for 3 months. And so you might hold on the disease so that somebody who has not had a chance to get the vaccine can get it in kind of an altruistic way. The other thing is there have been some reports that people who've had the disease have quite the local reaction when they get the shot. Again, that wouldn't be shocking. I mean, the first dose with Moderna is bad. The second dose is worse because your body already has antibodies to this. So there have been some reports that people who've had the disease can have a more significant reaction. Judy says, can we go outside the county to get a vaccine? Yes. Now, there are other counties that get a lot more vaccine than we did. So Deschutes County, in 1 week where we got 1,000 doses, they got 17,000. And they're not quite twice our size, but they got 17,000 doses in 1 week. And so they were able to do people lower, people at 65 even, because they had so much vaccine. So sure, you can go outside the county to get a vaccine. So Catherine says, will the provider list be expanded at all? Yes. And so as we have more vaccine, we can now give doses to others. So the vaccine comes in 10-dose vials, so you can't really give a practice any less than 10 doses. And there are a bunch of people who are getting them in 10-dose aliquots. So there are some, they were lower on the list and they would have gotten 5 doses or 6 doses, and there's no way to do that. So as we get more vaccine, we can do that. And the provider list, any provider can sign up to do it. And we'll accept and we'll expedite any provider's request. So Patty says, my 80-year-old mother has no primary care doctor. That really is tragic. I mean, at 80, things do start to fall apart, and you really should have a primary care doctor. And the plan we have for those who don't have a primary care doctor is that they should contact the pharmacy. So Donna says, are the vaccines safe? Yes. I think the vaccines are incredibly safe. Other than there have been a couple of local reactions where people get redness, soreness, pain, maybe fever and chills from the vaccine. The more serious reactions where people have had anaphylaxis do occur. As we've given more and more of the vaccine, we realize it's less common than we originally thought, about 1 in 100,000, but still there. Everybody who's had anaphylaxis has recovered, and so there have been no deaths associated with it. And so that overall, this is an incredibly safe vaccine. So Erica says, who's the current providers of the vaccine? So if you'll look in our daily press release, the providers who were able to get vaccine this week are in there. There's some providers like other pharmacies that are not in there because we just did not have enough vaccine to go around. So why are we getting so few doses? Tressa asked. Well, we're getting so few doses because there are so few doses. So the distribution from the feds to the states is based on population. And then the distribution from the state to the local previously was a little bit of a black box, but now is based on population. So the state had 20,000 doses, and we got 700 of those, which is just about our percentage of seniors. So I think that's okay. So I live in Reedsport, but go to a doc in Florence. Should I contact or book through my doc in Florence? Now, every county is doing it differently. So I was listened to KLCC on the way in, and Pat Ludke, who's their health officer, was talking about they have a big list to put people on, and they'll sometime in the future contact them. We chose actually to have the doc call your own doctor. So in Reedsport, if you do not have a doctor, you could try your doctor in Florence, or Lower Umpqua Hospital is going to take responsibility for that. I think also their pharmacy will get signed up, but not yet. So I'm in my 60s. We want to see our grandkids this summer. Do you think that's reasonable to think that we'll have access to the vaccine by July? So what's going to happen is we're going to do 80, over 80, then over 75, then over 65. If you're in your 60s, I don't know, because I think once we get with people who are over 65, there's going to be a complex list of other people who are at risk for getting the disease, including migrant workers and others. So I have not yet seen the plan for what we do after you get to people at 65. Now, if you said you were 67, which is still in your 60s, then we would have a pretty good view that it's going to happen sometimes in March or April. If you're 63, I don't know what the answer is going to be because the plan from the state has not been released. Turns out that as you start getting to that age group, you get more and more people. So we know about the baby boom, right? So the baby boom started in 1946 when people came back from the war. And in the 10 years after the war ended, people had a lot of babies. And that is the baby boom. And those people born in 45 are now 75 years old. So there's between 70 and 75 years old, there's a lot of those people. One of the questions that comes up is about the vaccine safety. So again, allergic reactions seem to be uncommon. Nobody is clear what's causing them. You know, when you have an allergic reaction, typically what you'll have is you'll have a kind of chemical in your body called IgE directed to whatever you're allergic to, so shellfish or nuts or whatever you're allergic to. They haven't been able to find any IgE in people related to anything in the vaccine, so it's still kind of a head scratcher. But the good news is we've gotten some data on the Johnson & Johnson vaccine. They say they're going to go for emergency use authorization sometime in February. There are not really a lot of worries with that vaccine, so I imagine it'll get approved. So we may be starting to do the Johnson & Johnson vaccine as early as March. Now, the good news on the Johnson & Johnson vaccine is that it's a single dose, and that's a good thing. The second is it doesn't require strong storage requirements, so that makes it much easier to distribute, especially in countries that don't have lots of electricity. I mean, we think about how hard it is to deliver a vaccine in Douglas County where we've got electricity and cars and whatever, but if you live in Africa, how in the world would you deliver a vaccine that has stringent storage requirements? And so when we were trying to eradicate polio, that was an enormous undertaking to be able to get this polio vaccine, which needed to be kept frozen, to people in the really remote parts of Africa. So the Johnson & Johnson vaccine we think is going to be good. The other one is the Novavax vaccine, which is a protein-related vaccine. It's a vaccine that basically they made the protein, which is the spike protein, and then put it in a vaccine, added a thing called an adjuvant, which is something which makes your body have a better reaction to it. And it seemed to work very well. But the big concern in all these are the variants. So variants are mutated viruses, and like everything, viruses mutate. And as viruses mutate, many of those mutations are going to be kind of nonsense mutations. Some will make it weaker, and then that one clade will die off, but you don't see very more. But ones that are more contagious tend to take over. So early on, there was the 614 mutation, which made the spike protein more stable. And what you see when you looked at different areas, that the one without the 614 made up almost all of the cases in the first month. But then as soon as that 614 mutation came into an area, within just a few weeks, all of the cases were the 614 variant. And we're worried with the UK variant and the South African variant that that's what's going to happen in those areas. And I'm a little worried, the only place we've seen the South African variant has been in South Carolina. And South Carolina is really struggling. And the concern is because it does spread quicker than the others, it's the one that's likely to take over, and they think it may be the predominant strain by March. The thing that we also worry about is, for example, the Brazilian strain. There are multiple cases of people who had COVID in the springtime and then got it again with the Brazilian variant and got really sick. So that's concerning. So will it be safe for households that have completed their vaccine to get together? So you remember, I never say safe or unsafe. I talk about a continuum of risk. If everybody who's been there is vaccinated, the chance that you'll spread the disease is about 10 times less than it would be if nobody had the vaccine. So that's good. So maybe if before you never went out, maybe now you would go out with a small group, and I think that would be okay. It makes the risk less, but still not zero. And then Betsy says, well, after I get my vaccine, can I hang out with friends without a mask? And the answer is no, because you don't know if you're the one who the vaccine didn't work for, right? So 95% effective still means there's 5% it didn't work for. So we're asking everybody to continue to wear masks. So Nael says, how do we get the vaccine to rural population? Many don't get TV, newspaper, or the internet. What about the radio? So I'm going to be on the radio Monday at 12:30. So good suggestion. Yeah, it is harder, but these providers we have are pretty much all through the county. So they go down south as far as Glendale, they go north as far as Drain, they go west as far as Reedsport. So we really do have a pretty good coverage in the community. So are Fred Meyer and Weimar the only two pharmacies giving vaccines in Roseburg? So almost all the pharmacies have signed up. We asked each of the pharmacies in town if they were interested in working with us on the plan, and Fred Meyer, Weimar, and Canyonville responded that they were, and because they were, we invited them to join. So Weimar with three locations, Fred Meyer with their Roseburg location, and Gordon's Drugs in Canyonville are working with us. The others will be giving vaccines. We think they're going to get their vaccines directly from the feds in a thing called the Federal Pharmacy Partnership. Now, since December, we've been hearing anytime now the pharmacies are going to start getting vaccine. And then 2 weeks later, you say, what's happening with any time now? And what we heard this week is any time now, the other pharmacies will be getting it. There was actually a little bit of meat on the bones on the presentation today. So there may be pharmacies in town who are getting vaccines directly from the feds, but it's not going to be very much. If I figure it out right, they're going to have like 100 doses between them, which is not very much. So how long after the people who get the vaccine will we have to mask and socially distance? So the masking and socially distance is to keep the rate of transmission low. But once the rate of transmission gets low, so once we get to the point where instead of having 5 to 10 or 15 cases a day, we have 5, 10, or 15 cases a week, then at that point it would make sense to relax masking and other kinds of guidelines. And so that's what it would be. So how will we get the disease that low? You can get the disease that low in two ways. One is we can up our use of masks and whatever else, and you can use the vaccine. It turns out that the social distancing and masking is equally effective as the vaccine. I know Dr. Redfield said they got a lot of crap for it, but it's true that if everybody very, very carefully masked and socially distanced, they could decrease the effective transmission by 70 or 80%, which is about as good as the Johnson & Johnson vaccine. So I think we're going to have to do this. The hope would be that by this summertime, there'll be enough people vaccinated, and it'll be summertime, so there'll be less disease. So hopefully in the summertime, we'll be able to relax those restrictions. But that's all a guess. And the number one thing that keeps me up at night is these variants. This variant in Brazil is so worrisome because it looks like the vaccine is going to work less well against it. It looks like prior infection is not going to be much protection. And if that Brazilian variant becomes the dominant strain in Douglas County, will be just like where we were last June. That is really heartbreaking. So is the vaccine safe for women who are breastfeeding? And so when they did the studies, because they were doing them, they want to get these done quickly, they did them on adults. They didn't do them on kids. They didn't do it on pregnant women. They didn't do it on women who were breastfeeding. So they did not study lots of people who were breastfeeding with this. Now, since then, people who have been breastfeeding have been allowed to get the vaccine, and many in healthcare do, and we have not seen any side effects from that. Although, what we always worry about in pregnant people and people who are breastfeeding is that could there be a later long-term effect, and that would take a long, long, long time to know. So I talk with your doctor. I would think it's probably safe for people who are breastfeeding, but the real goal would be to get everybody else vaccinated, because if everybody else is vaccinated, those few people who are breastfeeding, probably not more than 1 or 2% of the population, or are pregnant, probably not 1 or 2% of the population, or have severe anaphylactic reactions, do not need to get vaccinated because enough people around them will have vaccine. Okay, a couple of other things here. Some really fascinating research on drugs that might work for this disease. So they have figured out a way now to go ahead and grow cells that are susceptible to this disease. They found some a bunch of drugs that might work against this. They then put those drugs in with those cells and then infect the cells and see what happens. And, they find a few things that work. So clearly remdesivir works. There's this one called Aplidin, which is a drug that's used to treat multiple myeloma. And that seemed to work. Rheumatoid arthritis drugs seem to work. There's a lot of stuff about ivermectin, and I reviewed the data on that again today. It's really all up in the air. There's one doctor, especially from Milwaukee, who absolutely says it's an absolute miracle. It works great. Other people looked and said, well, it doesn't look like a miracle to me. And so it's so hard to know whether it works. And as a provider, it's really disturbing that we just haven't done the study. I mean, you'd only really need to carefully study 1,000 people to know exactly whether it worked or not. I mean, we have 200,000 new cases every day. So to enroll 1,000 people should not be that hard. In really a month, you'd have the answer. We've been talking about this since May, and I don't know. The doctor especially does is Dr. Corey from Milwaukee, and he is just a total zealot, that you can't even do any more studies because I'm so certain it works. But there's a couple of things that worry me about his plea. One is that he in the past came up with a magic cure for sepsis, which turned out not to be magic at all. And, he works in Milwaukee. A bunch of people in Milwaukee follow him and give ivermectin. They've actually had more deaths than Douglas County. So this was truly a miracle drug, which you'd expect to see. When you looked at the deaths, you'd say, that's really weird. There's half as many expected deaths in Milwaukee as you'd expect. Actually, it turns out there's 3 times as many. So if it really worked, I don't know. Now, ivermectin is pretty safe. I mean, we use it for benign things like head lice. So, I don't think it's going to be a big danger. Whether it works or not, I just don't know. And so there are a bunch of other drugs out there that you're trying. I will tell you, as a provider, it's just maddening that it's taking so long. I mean, there are some studies that would take a long time, like does this drug cause cancer 10 years from now? Well, you obviously need to wait 10 years to know. Or will this drug prevent heart attacks over the next 20 years? You need to study people over 20 years. This one, you're saying is, do you get less sick if you take this drug? You'll know after 10 or 15 or 13 days. And so it's really frustrating that we do not have more good studies. So Krista says, does the AstraZeneca Oxford vaccine work with the Brazilian strain? We do not know. So it was tested in that area. There were a lot of troubles with their trial in Brazil. They used they used half of the expected dose. They had all kinds of different variable times between the first and second dose. They had a lot of people they lost to contact. So I think the AstraZeneca vaccine trials are going to be really, really hard to know in Brazil. All right, so Carol says, if a person tests positive for COVID, what is the time frame you use to do contact tracing? So let's say I developed symptoms today. So if I developed symptoms today, I might have been contagious on Wednesday and Thursday. If I'm asymptomatic and had a positive test today, I likely also could have transmitted the disease on Wednesday and Thursday. So we usually go 2 days before you have symptoms or 2 days before you have a positive test. And then anytime in the 10 days after diagnosis, you're considered to be contagious. So 2 days before and 10 days after, you're contagious. And then we look to see if people have significant contacts. We have many contacts every day with people. We generally think that about 15 minutes at less than 6 feet is a significant contact, with caveats, right? If you were even 14 minutes and you were right in somebody's face, that probably is a significant contact. If you were 2 hours, 7 feet apart, that's still a significant contact. And so we have to use some judgment in what is a significant contact. So it is, again, 2 days before the onset of symptoms, or for asymptomatic people, 2 days before the onset, before the positive test, and then 10 days after. So Gabrielle says, do you have thoughts on some new places that say we need double mask? Well, I think masking works. I know everybody doesn't believe that, but I do think masking works. And I think using using a better mask is better than a less good mask. I mean, what really gets me is the number of people I see out there who are doing this thing. That's probably not working for anybody. So what I recommend is that use a mask that covers your mouth and your nose when you're around other people indoors, or when you're around within 6 feet of people outdoors. Double masking is better. Double masking is really quite uncomfortable, but yes, double masking is better. So TD says, can we get the vaccine in Eugene if our provider is there? Perhaps you might give them a call. Again, the Lane County structure is quite different. The Lane County structure has depended on these large events. And again, we don't think these large events really make sense for seniors. And my mom turned 91 last week, and I just can't imagine her having to sign up online and then get a call that, oh, you're going to be there, so she has to drive, and she's still driving. That she has to drive and get there and then wait in line outside in the rain maybe, or the snow or whatever, for an hour until they get in, then go in with all those people. That is just awful. If she could call her doctor, get her a vaccine there, that seems to be a far better way to do it. How long can you shed virus when your single strand test is negative? I don't know what that means. I don't know what your single strand test means. So, Mari, if you could tell us what you mean on that. Now, there are lots of different tests for this virus. Some use 3 probes, some use a single probe. And so I don't know what that one means. Okay. Let's see what else we got here. So there's this drug from C-Swerves called Aplidin, which has been in the news this week. They say it's 29 times stronger than remdesivir. And I saw the data, and it looks like it could work. It blocks the EEF1A. Oh, it's so complicated these days. The EEF1A receptor. And so that's exciting. They're going to move on to phase 3 studies. And again, on the ivermectin, I'd really like if people could move on to a phase 3 study. So, how will be getting the vaccine in a pharmacy be safe if there are anaphylactic reactions? Well, it turns up, it turns out that the pharmacies are all ready to do anaphylactic reactions. They're giving other vaccines. They're well trained in it. And again, they're rare. We've not seen any yet in Douglas County. So why can't we have a sign up as many places do? Yeah, we looked at that. So really, look at Eugene and tell me if you want to be on their list. Because the way they're going to do it, they're going to put you on a big list, and they're going to call you or send you an email sometime later on to maybe tell you about an event. That would be awful. I think you need to sign up with a place where you're going to get the vaccine so that they can call you when the vaccine arrives and it's ready for it. So we chose this model, and actually they say it is now going to be the model in the state. Yeah, so how long can you shed virus if your rapid test was positive, but your PCR test was negative? So the rapid test is an antigen test. So it looks for the protein that's on there. We think that one comes up a day or two before you are symptomatic, stays positive for a week or so, and then goes away. The PCR probably turns positive a day or so before the rapid test, and then on average stays positive for 24 days, although it can stay positive for either shorter or longer than that, but on an average of 24 days. Again, if your rapid test is positive and you're not in a high-risk group, severely immunosuppressed or hospitalized, there are no cases where you've shed the virus 9 days after a positive test. So 0. In the whole world, everybody looking, there are 0 cases. If you're hospitalized or immunosuppressed, there are some cases where people have shed 12 to 19 days, but again, no more than 19 days. So who do we bug to get more vaccine in the country? I don't know. I mean, this is a worldwide distribution. I think Moderna and Pfizer are working as fast as they can. I think the feds have distributed vaccine fairly evenly. Not so much with the state early on, but it's now evened out. So I I don't think there's anyone you can bug to do it. If there is, please let me know. I have been on the phone all week trying to get more vaccine. So Lower Oak Hospital doesn't have a sign up. Call on Monday. Yeah, call on Monday and they'll get you in. I just spoke to the person who's doing that, and they came over yesterday to get 100 doses, and I think they're going to get another 100 doses on Monday. So call on Monday. And the reason we're asking you not to call over the weekend is people really need their rest this weekend. Monday, we'll do it. All right. I thought there would be more questions. So about vaccines. So we understand that seniors will sometimes not want to will want to talk with other seniors about the vaccine. So we have enlisted the help of the people who do Sheba and a bunch of volunteers from Winston who are going to help us with these calls on Monday. So we've had this call center going since March, and this call center takes calls and whatever. We know on Monday we're going to get a lot of calls on vaccines, and what we would like to do is we would like to send those calls to these Sheba volunteers who are going to go ahead and help you with this. And so, again, call your doctor. If you don't have a doctor, call the pharmacies. If you have questions, call the hotline and ask to speak with one of our Sheba volunteers. All right. Okay. Well, that's it. That's great. I'm feeling a little under weather from having gotten the vaccine yesterday, so I'll be glad to be done earlier. Let's give 1 or 2 minutes to see if people have more questions. So one of the things that came this week is, how do masks help? And one of the things that comes out and has been is that one germ, it takes more than one germ to infect you. Just like if you had a sperm count of 1, you would never get anybody pregnant. So you have a sperm count of several million, and the sperm work together to fertilize an egg. Similarly, when you get infected with any germ, it's not one germ that you get. It's typically anywhere between 10,000 and 1 million. And what they've seen is that by wearing a mask, it does not necessarily totally protect you, but actually decrease the amount of virus that's out there and decrease the amount of virus that you take in. The other thing is that there's some reasonable data in other animal models that if you're infecting doses on the low side, you tend to have a mild disease, whereas you're infecting doses on the high side, you tend to have a really severe disease. So in the old days, when we used to have chickenpox, kids would get chickenpox at school, and they would have a mild case, and then their sibling would get it 17 days later, mark it on the calendar. And almost always, the sibling would have worse disease than the first case, and that was because the sibling and the first case had a lot more contact than the kid who got it at school. And so there is something to say about doing that. So Bruce says, can you talk about the at-home tests? So there are at-home tests. Most of the ones are collected at home, and then you send them to a lab. The labs do them, and then we get the results on that. They seem to be okay. We're a little worried about them because they have to be collected exactly correctly. And we know when we give people instructions and then watch them, they're frequently really wrong. I mean, it's not a hard thing, put in the nose, go around 5 times. But when we watch people, it's like, whoa, you weren't listening? And so we are a little worried about these at-home tests, that they may have some issues there. So they may have some issues with the test. Then there are tests where you can do the test at home. We're even more skeptical of those because, again, if you don't collect the swab right, you may not actually do the test right. And so in Oregon, if you have a test which is samples taken at home and sent to a lab, it's considered a case. If you have one where you do it at home and actually do the test at home, it's considered to be a suspect case and not counted as a case. So Jay says, why are the feds waiting 3 weeks to review the J&J vaccine? There's just so much data you have to put together to get it done. So if you look at these EUA applications, emergency use authorization applications, they're like 80 incredibly complicated pages. And I think what's happening is they're putting together the 80 complicated pages. Then what happens is the staff from the FDA goes through all of that stuff with a fine-tooth comb and asks questions like, it's a little concerning here that the time to the second dose was, is a large range. How did you change that? So they ask the questions, and then by the time the FDA panel sees it, they're going to know the answer. But it is complicated, so I think 3 weeks actually is about the earliest you could do it. It turns out with Moderna and Pfizer, they had their results about 3 weeks before they did their emergency use application. So I don't think that there's any issue. It's just a really complicated and very rigorous process. I actually looked at the thing. These guys really ask great questions, and they really picked this apart. I mean, their job, if you're on this FDA panel, is not to let an error get through. Imagine if you're doing this, you say, oh, sure, let it be done, and then you turn out that there's some big problem that you missed. There'll be hell to pay. So that's going to be an issue. Louis says, are there other fire districts that may be joining the list? So yes, we have 4 fire districts now that are helping us, including Glendale, Umpqua Valley Ambulance, Fire District 2, and Scottsburg through Lower Umpqua Hospital, and they're helping us with this. We're not exactly sure where they're going to fit in with vaccination of seniors, but they're more than willing to do it. Sandy tests are most rapid tests accurate. So the rapid tests that we're using mostly here in Douglas County are the Binax now. They are very accurate in symptomatic people. So if you're symptomatic and you get a test, they're really quite good. They are not very good at picking up asymptomatic people. So using those like screening before you get on a plane, using like screening before you go to a concert, they miss about 2/3 of the cases. So they're not very accurate for asymptomatic people with low risk. But if you're an asymptomatic contact, they're pretty good. If you're symptomatic, they're great. And so we'd actually recommend now that for symptomatic people, the first choice is a rapid test. And the reason the first choice is a rapid test is you get the results back in 15 minutes. And then you can start quarantining people and going back. If you do the PCR test, it takes 3 or 4 days. By then, it's a long time to go back. So Carol says, why not enlist the VA to help getting vaccine out? So again, the problem is, again, not enough vaccinators. We have, if they gave us 3 times the amount of vaccine, we'd have no trouble finding vaccinators to give it. The trouble is not getting enough vaccine. The VA gets vaccine through the Veterans Administration. They're not sharing. And so they're doing veterans and they're doing their healthcare workers, but they're not sharing with non-veterans. And so, if you could convince them, that would be great. They've got a lot of seniors. Most of the people who fought in Vietnam are now of the age where they should get the vaccine. And so I think they've got plenty of their own work to do. I mean, if you can figure out a way to get the VA to let loose on some of the vaccine, that would be great. But I don't have much hope. All right, so where can you get information on this? So we're trying to get the information out in as many ways as possible. So we're doing our daily press release. It's really incredibly well written. I mean, I don't do any of it, but Vanessa and Tamara do an incredible job with doing it. The whole plan is there. You can go on our website. The whole plan is there. It's going to be in the newspaper on Sunday. We hear it. The whole plan will be there. I'm going to be doing the radio on Monday. The whole plan is there. And we're going to go ahead and read it off. And so it's going to be on a message phone so that on Monday, if people don't want to use one of those other ways, they can call that number and get the plan read out to them. We also have Spanish-speaking people, so that people need language help, we have that. So again, our website, douglaspublichealthnetwork.org, has all the vaccine info on it. The daily press release has all the vaccine info on it. We're told the news review is going to have all the info on it, and so it should be great. I'm really pleased with the plan here. This plan didn't come together without the incredible participation and the generosity of some people. So first on the top of the list, it's got to be Aviva. They have stored all the vaccine. They've distributed all the vaccine. They've done our 3 big events. They really have been great. But in addition to them, the CCO, many of the other small practices, EMS, Lower Umpqua Hospital, Mercy Hospital, have all done an incredible job at coming together and making this work. When I talk about our plan to other people, say, oh my God, how did you pull that one off? Because usually docs are it out of the throat. And they are in Douglas County too, but when it comes to vaccinating people and vaccinating seniors, everybody's pulled together and has put their differences behind them, and people are really working together. All right, so I'll see you on KQEN Monday at 12:30. Look for us in the newspaper on Sunday, and I think that should do it. Okay, again, this is Dr. Bob Danhofer, Public Health Officer from Douglas County. Be safe and be kind, and we'll do this again on Tuesday. Thank you.